listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, agents and agencies are considered to be third-party marketing organizations in the eyes of CMS. We are covering the rules and guidelines you need to know. Insurance agents as TPMOs. What CMS compliance regulations mean for you. Since their final rule for contract year 2023, the Centers for Medicare and Medicaid Services, CMS, has implemented rules for third-party marketing organizations, or TPMOs for short. Let's get straight into the requirements that impact your business, starting with the marketing and communication updates, which include defining TPMOs, necessitating use of a standard disclaimer, both when the entities are marketing fewer than all plans available in a given geographical area, and when the entities are marketing all plans available in a given geographical area, and implementing new rules regarding plans oversight responsibilities. Here at Ritter Insurance Marketing, we know the importance of staying compliant. We strive to keep you up to date with any compliance changes, including call recording, marketing and event parameters, and more. These regulations pertain to agents, so let's take a closer look at them so you can stay compliant. Now, you might be wondering, what exactly are third-party marketing organizations? CMS defines third-party marketing organizations as, quote, organizations that are compensated to perform lead generation, marketing, sales, and enrollment-related functions as part of the chain of enrollment, end quote. By this definition, CMS considers all insurance agents and brokers to be TPMOs. Therefore, insurance agents and brokers must adhere to all CMS third-party marketing organization rules and guidelines. So, what do agents and brokers need to do as TPMOs? Agents and brokers should adhere to the following 12 rules. Number 1, agents must add the TPMO disclaimer to your website and email communications. It must be read within the first minute of all sales calls. The disclaimer must also be included verbatim to all of your marketing materials. Number 2, when conducting lead-generating activities, agents must disclose to the beneficiary that his or her information will be provided to a licensed insurance agent for future contact in the following circumstances. Verbally, when communicating with the beneficiary through the telephone, in writing when communicating with the beneficiary through mail or other paper communication, and electronically when communicating with a beneficiary through email, online chat, or other electronic messaging platform. Number 3, when conducting lead-generating activities, you must disclose to the beneficiary that he or she is being transferred to a licensed insurance agent who can enroll him or her into a new plan. Number 4, do not share personal beneficiary data with other TPMOs unless prior express written consent is given by the beneficiary. Prior express written consent from the beneficiary to share the data and be contacted for marketing or enrollment purposes must be obtained through a clear and conspicuous disclosure that lists each entity receiving the data and allows the beneficiary to consent to or reject the sharing of their data with each individual TPMO. Number 5, agents must record calls, including video calls, with beneficiaries in their entirety. Call recording is limited to marketing, sales, and enrollment calls. The term marketing includes retention marketing aimed at influencing a beneficiary to stay enrolled in a current plan. The mention of any benefits, like dental, vision, hearing, premium reduction, or cost savings, also fall under that umbrella of marketing and should be recorded. Number 6, you must identify and make a list of all vendors, contractors, and subcontractors you use for marketing, sales, lead generation, and enrollment. Number 7, agents are required to revise existing written agreements with all of your TPMOs to require your TPMOs to be compliant with TPMO regulations. For example, vendors, contractors, and subcontractors, whether you use them for marketing, sales, lead generation, or enrollment. Number 8, on a similar note, agents must enter into written agreements with all TPMOs with whom you have relationships, but do not have written agreements that require the TPMOs to be compliant with TPMO requirements. Again, vendors, contractors, and subcontractors for marketing, sales, lead generation, and enrollment. If you work with a TPMO, you must have a written TPMO agreement with them. Number 9, develop a process for disclosing to the plans the vendors, contractors, and subcontractors you use for marketing, sales, lead generation, and enrollment. Your process should include a method for reporting changes to the list as well. Number 10, disclose to the plans your vendors, contractors, and subcontractors for marketing, sales, lead generation, and enrollment. Number 11, develop a process for reporting to plans monthly any staff disciplinary actions associated with beneficiary interaction to the plan. That should also include a process for reporting violations of any requirements that apply to the plan associated with beneficiary interaction to the plan. Number 12, report to plans monthly any staff disciplinary actions associated with beneficiary interaction to the plan, as well as violations of any requirements that apply to the plan associated with beneficiary interaction to the plan. Another very important rule that we touched on briefly, but I want to get into a little more detail. Agents and brokers must get written consent to share client data. According to the 2025 final rule, as of October 1st, 2024, third-party marketing organizations may not sell or share personal beneficiary data with each other without obtaining prior express written consent from the beneficiary. CMS writes, quote, individuals may be unaware that by placing a call or clicking on a generic-looking web link, they are unwittingly agreeing and providing consent for their personal beneficiary data to be collected and sold to other entities for future marketing activities, end quote. Obtaining prior express written consent aims to curtail TPMOs selling and reselling personal data without the beneficiary realizing it. Furthermore, the rule stipulates one-to-one consent, meaning that the consent you obtain is only good for the TPMO to which you're sharing. Prior express written consent must be obtained through a clear and conspicuous disclosure that lists each entity receiving the data and allows the beneficiary to consent to or reject the sharing of their data with each individual TPMO. One generic, blanket written consent is not permitted. TPMOs must still obtain written consent even when sharing data to another legal entity under the same parent organization or to a downstream entity. CMS also requires obtaining written consent even when manually dialing leads to keep individuals from being called by TPMOs to whom they have not given permission to be called. An exception to the rule is when a beneficiary can be connected to another TPMO in real time. A beneficiary may call an agent seeking information about Medicare plan options, and that agent, to assist the beneficiary, may be able to transfer or connect that beneficiary to another agent during the call to provide real-time assistance. When obtaining written consent, the disclosure you use must be transparent and prominently placed. At this time, there is not a standard CMS disclosure. Next, we'd like to examine important disclaimers for Medicare marketing materials when marketing Medicare Advantage and Medicare Part D. Starting with one we previously mentioned, the Third-Party Marketing Organization, or TPMO disclaimer. For TPMOs that do not sell all Medicare Advantage or Part D plans within a service area, the standard disclaimer is as follows, quote, "We do not offer every plan available in your area. Currently, we represent X number of organizations which offer X number of products in your area. Please contact Medicare.gov, 1-800-MEDICARE, or your local state health insurance program, SHIP, to get information on all of your options," end quote. And then for TPMOs that do sell all MA and Part D plans within a service area, the standard disclaimer is as follows, quote, "Currently, we represent X number of organizations which offer X number of products in your area. You can always contact Medicare.gov, 1-800-MEDICARE, or your local state health insurance program, SHIP, for help with plan choices," end quote. In both of those circumstances, you would fill in the number of organizations and products available in the area you are targeting with your marketing materials. Say you're an agent representing 3 carriers, and each carrier has 2 products in your area. This is what the disclaimer should sound like. Quote, "We do not offer every plan available in your area. Currently, we represent 3 organizations which offer 6 products in your area. Please contact Medicare.gov, 1-800-MEDICARE, or your local state health insurance program, SHIP, to get information on all of your options," end quote. TPMO disclaimers are required on all TPMO marketing materials, including all print materials and TV ads that are used, created, or distributed by a TPMO and that meet the definition of marketing. All TPMO websites must prominently display the disclaimer, and it must be provided electronically when communicating with a beneficiary through email, online chat, or other electronic means of communication. Additionally, the disclaimer must be provided verbally within the first minute of the sales call. If you are meeting with a client face-to-face, the TPMO disclaimer is not required to be conveyed during that in-person meeting. That is the one exception. Next, we have lead generation disclaimers. TPMOs conducting lead generation activities must inform the Medicare beneficiary that their information will be provided to a licensed agent for future contact, or that the Medicare beneficiary is being transferred to a licensed agent who can enroll them in a new plan. This is to be done verbally, electronically, or in writing, depending on how the TPMO is interacting with the Medicare beneficiary. All lead generation forms are required to clearly state that a licensed agent will be contacting the Medicare beneficiary. For example, quote, "Your information will be provided to a licensed insurance agent. You may be contacted by a licensed insurance agent," end quote. Lead generation disclaimers must also be used in call scripts. When transferring the call to a licensed agent, the individual speaking to the beneficiary must clearly state the call is being transferred to a licensed agent. Here's an example of a call being transferred to a licensed agent. Quote, "You are now being transferred to a licensed insurance agent who can enroll you in a new plan," end quote. Moving on to the federal contracting statement. This statement must include the legal or marketing name, the type of plan, a statement that the organization has a contract with Medicare, and a statement that enrollment depends on contract renewal. The federal contracting statement is required on all marketing materials except banners and banner-like advertisements, outdoor advertisements, text messages, social media, and envelopes. Here's an example of the federal contracting statement disclaimer. Quote, agent or agency name is a licensed and certified representative of Medicare Advantage organizations and standalone prescription drug plans. Each of the organizations they represent has a Medicare contract. Enrollment in any plan depends on contract renewal. End quote. Now, let's talk star ratings. A star rating disclaimer must convey that plans are evaluated yearly by Medicare and that the ratings are based on a 5-star rating system. It is required on all marketing materials that mention star ratings. However, because of space limitations with electronic media, like in search ads or on social media, it is acceptable to provide the star ratings disclaimer to the viewer when the viewer clicks on the ad. An example of this disclaimer, quote, every year, Medicare evaluates plans based on a 5-star rating system, end quote. Up next, accommodations. For all invitations to events, including educational, marketing, and sales events, there must be a statement that conveys accommodations are available for persons with special needs. This disclaimer should provide a telephone number and a teletypewriter or TTY number. For example, quote, for accommodations of persons with special needs, call and then insert your phone number and the TTY number. End quote. This next one has to do with promotional giveaways, prizes, free gifts, and drawings. This disclaimer must convey that there is no obligation to enroll in a plan and is required when offering promotional giveaways, such as drawings, prizes, or free gifts. A simple example, quote, eligible for a free drawing, gift, or prizes with no obligation to enroll, end quote. Now, let's get into product endorsements or testimonials. Disclaimers are required when individuals endorse an MA organization's product. The speaker must identify the MA organization's product or company by name. Medicare beneficiaries endorsing or promoting MA plans must have been a member of the plan at the time the endorsement or testimonial was created. Endorsement or testimonial must clearly state that the individual was paid for the endorsement or testimonial if applicable. If an individual, such as an actor, is used to portray a real or fictitious situation, the endorsement or testimonial must state that it is an actor portrayal. For example, quote, paid endorsement, end quote, or, quote, paid actor portrayal, end quote. Next, we have disclaimers for not being affiliated with Medicare or the government. These disclaimers are required on all communications and marketing materials. They must convey that the organization or agent is not affiliated with or endorsed by any government agency. If a material includes the word Medicare in the organization's name or logo, it must be clearly stated that this is a non-government entity directly below the name or logo. So, for example, quote, not affiliated with or endorsed by any government agency, end quote. Another example, the phrase, quote, a non-government entity, end quote, directly below a name or logo that contains the word Medicare. Moving on to member-facing websites. All member-facing websites must include non-conspicuous verbiage relating to accessibility and non-discrimination. The following example is a recommended addition to the footer of a website and should link to a page that contains all the required information. Quote, the plans we represent do not discriminate on the basis of race, color, national origin, age, disability, or sex, end quote. This next one isn't a disclaimer per se, but it's still an important rule. When providing materials in different media types, recipients must be able to unsubscribe or opt out of the content. After giving consent for electronic mailings, an individual must be able to opt out. Include an opt-out or unsubscribe option in email communications that include instructions or a link with instructions on how to opt out. The unsubscribe link must be active and must truly unsubscribe someone from future email messages as described in the unsubscribe instructions. Now, what about materials that include an agent's phone number? Materials that include your phone number should clearly indicate that calling the agent's number will direct an individual to a licensed sales agent. Use this disclaimer when listing a number that dials a sales agent. Additionally, the listing must also include TTY 711 next to the phone number for individuals who use a teletypewriter. Immediately prior to including the agency's number or any number that will reach a sales agent, materials must state that the number will dial a, quote, licensed sales agent, end quote, or, quote, licensed insurance agent, end quote. Lastly, I do want to touch on Medicare Supplement here because depending on the state you're selling in, you might also need a disclaimer for this product type. So again, while the previous rules and regulations were for agents selling Medicare Advantage and Medicare Part D, this one is for Medicare Supplement. State requirements may vary on required content and disclaimers. Therefore, we recommend the following disclaimer at a minimum. Quote, "This is a solicitation for insurance," end quote. That will at least, again, at the bare minimum, let the person viewing your materials know that the intent is marketing MedSup insurance plans. And that concludes our rundown of TPMO compliance. We've covered a wide range of rules and guidelines in this episode. So if you have questions about when and how to implement them into your practices, don't hesitate to reach out to us. You can email us at asgpodcast@ritterim.com, and we will work to get you the answers you need. We will also continue to work hard bringing you the latest updates in compliance, so be sure you're following along with our show. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.